Most common joint to be replaced is the knee, followed by the hip, and then the shoulder. Behind that, you've got an occasional elbow. Knee replacements is basically a resurfacing of the joint. The reason knee replacements work is they look like a knee. They're just not made out of cartilage anymore. It's metal and plastic. And then a hip, on the other hand, is a ball and socket. You replace the socket with metal with a plastic liner usually, and then on the ball side you replace the head with usually a ceramic, sometimes cobalt chrome head. As far as hips go, most of the patients develop hip problems. They'll have pain in the groin, maybe buttock a little bit, thigh, sometimes even get down to radiate to the knee. And then as far as knees go, knees generally just hurt mainly in the knee. They don't refer up to it's not reverse. It doesn't hurt up into the hip usually, it's generally in the knee. Most of the time you can tell just from plain x-rays whether someone's hip or their knee is worn out. Occasionally an MRI will help show you there's been more damage than you think, but most of the time you can tell from the x-rays. People ask me, they say, how do I know if I need surgery or not? And basically you say, well, if nothing else helps and it's interfering with the quality of your life and your activities, then it's something you might consider. I still have most of my patients do physical therapy. I prefer outpatient therapy as opposed to home therapy for two reasons. One is I think if you do outpatient therapy, they've got more things to work with. And number two is to get you out of the house. This is not like changing an oil in a car. These are people that we're taking care of, and everybody's different. And so, you kind of have to do different things for different people. That's one of the reasons why I love what I do so much, because I have patients that come in like that. And you can take someone whose life is miserable and give them their life back.